Treatment. Prophylaxis. Prevention of cystitis is an important element in the treatment of prostatitis, stricture, prostatism, bladder stone, and tumor, as well as in every passage of an instrument into the bladder. It requires no special notice here. Treatment of acute cystitis. The cause of the inflammation should be removed if possible. If not, the patient is put to bed, medicated with balsamic and anodyne, page 221, and with hot rectal irrigations, page 209. For local treatment, installations of argyrol, carbolic acid, and silver nitrate may be of use. The first is sometimes singularly soothing and may be repeated as often as twice a day, 20 drops of a 20% solution. If this fails, 5 drops of 2% carbolic may be tried once. For gonorrheal cases, 2 drops of a 2 to 4% solution of silver nitrate is peculiarly soothing. It is scarcely necessary to add that none of these remedies will be efficacious unless retention is relieved. Treatment of chronic cystitis. The peculiarity of chronic cystitis, depending, as it always does, upon some other morbid condition, renders its special description unsatisfactory and begets a necessity for constant reference to the other affections which underlie it. A reference to the sections on those diseases with which cystitis is especially associated, notably prostatism, stricture, and stone, will give a better foundation for treatment than anything that can be said here. In general, the radical treatment of chronic cystitis consists in removal of its cause. If the cause is not removable, or if it has been removed, the treatment is palliative. Attention to the general health, the urinary hygiene, the condition of the bowels, and the quality of the urine constitutes the essential background, the passive part of the cure, as it were, while the active work is performed locally. The urine must be modified. Its specific gravity should be kept below 1.020. Below 1.015 if possible. This object is attained by making the patient drink water. Some balsamic is administered together with an alkali, as in the treatment of acute gonorrhea. Chronic ulcerative cystitis, due to the pyogenic cocci, is very rebellious. I have cured cases by installations of 2% carbolic acid, by injections once a day of 5 cc's of a culture of the Bacillus acidophilus, by installations of 2 cc's of 20% argyrol once or twice a day, and by injections of acetic acid as strong as the patient can bear, 1 to 500 up to 1 to 200. Encrusted ulcers may be cured by similar treatment. I have cured one case by picking off the incrustations with a cystoscopic forceps, one by curetting through the female urethra, followed by cystoscopic forceps, 2 by acidophilus bacillus, and one which resisted all treatment got well spontaneously with the casting off of the incrustations 3 months later. I operated upon 2 cases suprapubically. One died of hemorrhage, the other relapsed, and was cured by the acidophilus bacillus. Suprapubic incision and curettage or excision of the affected areas is the only treatment for cystitis cystica and granulosa and for leukoplakia. It is not brilliantly successful. Interstitial cystitis, causing contraction of the vesical cavity, is best treated by relieving the retention or other cause of cystitis. With the amelioration of the inflammation, the bladder is likely to expand somewhat. Mechanical efforts to dilate the bladder are doomed to failure. Suppurative pericystitis requires free suprapubic drainage. The local treatment is the most important. This is the active, efficient part of the treatment from which a cure is expected. It must be systematic and intelligent. The more acute or recent the inflammation, the more advantage there is in using installations and in pushing the strength of the solution to the limit of toleration. I have had most success with nitrate of silver and permanganate of potassium. Chronic, long-standing cases cannot be cured unless the cause of inflammation is removed. Ammoniacal inflammation may sometimes be overcome by vigorous local treatment, and the attempt should always be made, as the patient is far safer with chronic acid cystitis than with chronic alkaline inflammation.